Jonathan, thank you so much for taking some time this morning. So I think the place that I'd like to start is where our relationship started. A few years ago, you joined us for Powder Strong, and I'd love to hear what your goals were, what you were looking for, and then in the sea of opportunities for preseason ski training, why'd you end up deciding to go with us and stick with us?
Yeah, so a few years ago, I had just kind of gotten into skiing. Maybe I'd done like half a season and then a little bit gotten into like the following season. And just I noticed that I was starting to have a lot of pain around my knee. I'd had two ACL tears in the past and didn't do a great job rehabbing the second one. So I had gone to a PT, but found kind of middling results of that and really wanted something more strength based, something where I felt like I could build up the strength in my legs and alleviate a lot of the pain that I was feeling whenever I would go skiing. I was committed to skiing, but wanted to figure out how to do that in a way that was relatively pain free. So, a friend of mine who was a ski instructor had recommended looking into a powder strong type program. And at least at the time, the only ones that I could find were yours and the University of Utah. And I liked that from yours from WFA, it sounded like the Powder Strong program that you had was a lot more community based. It was a lot more interested in providing a space for people to really connect there, whereas the University of Utah just seemed like more of a volume based. Let's get in, let's work with some PTs and try to get ready for ski season that way. So elements of there being more of a community and it being very, very open to different abilities and try to meet you where you're at really spoke to me.
Awesome. And then thinking about progress and kind of outcomes from that season, and I think this is probably year 3 of Powder Strong. I'll let you
Mm-hmm.
figure out how many years you've been skiing and decide from that.
Yeah.
This will be our 4th year. This actually might be your 4th because it's our 4th
Yeah.
year in our current location. And I know you joined us where we are now location wise. So what are the milestones? What has it felt like? What value have you seen when you've been skiing? Like you had said you had been having some knee pain residual
Mm-hmm.
from surgeries. How has that been generally, obviously up until last season? And we'll talk through that one separately.
Sure. Yeah. Yeah. No, I got to see continual progress, which I really enjoyed. Like it certainly didn't happen overnight, but it gave me the confidence to keep going and to keep pushing. I think within the first season, I noticed a lot less pain, and a lot less or a lot better endurance. And there was definitely points along the way. I remember asking you like, "Hey, I would get like halfway down a run, and my knee would just seize up, and it would feel like I would need to stop and like bend my knee and like re-straighten my knee just to like get things going again. Is there something we can work on there?" And you would give me recommendations, or I'm feeling a lot of tightness here. What's something that I can do with? And you would tell me about the couch stretch and told me about Kelly Starrett and becoming a sub leopard. And so started reading more into that. And I just found a lot of immediate little fixes right away that built upon themselves. And so by the time I got to last season, before things took a little bit of a nosedive, I felt great. Like it felt like I could ski all day. There was little to no pain at the end of the day. Everything felt a lot more balanced side to side. It felt like I'd really overcome that specific injury and chronic pain issue. And I would find myself no longer gassed at the bottom of a run. Like all my quads felt great. So I was able to just ski as long as I wanted all day, which was a huge improvement from where I started.
That's awesome. Yeah, and it's that kind of, if we think of like that baseline that I would want for everybody is that you can ski without pain. And then on top of
Mm-hmm.
that, it's the like, yep, I've got the endurance and the capacity to go all day. That's fantastic. So let's talk about last season
Mm-hmm.
and injury, like injury mechanism, injury once diagnosed, and then what the path has been to basically where we are now. And and basically on Monday, you're going to start the Powder Strong programming for this season.
Yeah, yeah. So, end of March, I broke my leg. Pretty significant, multiple breaks in the tibia. Had to have a plate put in, screws, the whole nine. And so I knew coming out of that, I would need to work really hard to get back into skiing and be ready for the next ski season. That's not something I wanted to give up. Coworkers who, after I came back from a bit of a leave of absence, post surgery were like, "Are you ever going to ski again?" And I was like, "I've already got my ski patch for the next year. Like this is yeah, that's not a question." So then it just became a question of how do I prepare my body for that. And so what I definitely leaned on most is the more personalized programming that you're able to provide, which has really been so helpful. There's other things that I do, but I would say that has had the biggest factor or the biggest yeah, it's been the biggest factor in my progress. So really have enjoyed that program and being able to communicate when something feels a little bit too intense or I feel like I could do more in a certain area and being able to even just not even really need to have the conversation, but the way the system is set up to punch in, okay, here's where I was at this week for weight and reps and all that. And then you taking that and building on it. And I think I made the comment last time I was in the gym of you've done a great job of putting like the level of intensity right at my upper limits and continuing to push me further and further in a way that feels responsible and doesn't feel overwhelming at all. I'm definitely able to continue pushing myself and seeing that progress. So was very happy when I saw my PT last week and she said, no, everything looks great. I think you're ready for Powder Strong. Maybe some minor adjustments here and there that I know we talked about being very accommodating with those minor adjustments, but it's great to have the confidence to be ready to join Powder Strong and get back into the group classes and be ready for ski season.
Of that. And one of the things that makes, when that comment you made last week of that I always know where to like how to adjust intensity to get you right at that limit. Part of
Mm-hmm.
that too is also our communication, right? It's how often it's that you and I really informally, but like we cross paths at the gym at least once a week, whether it's I'm in and you and I both happen to be in, or I'm running a session and you're there. It's that communication is what lets me also feel really confident in pushing that. And so
Yeah.
you get a lot of credit on that too. And actually my next question is about something else that you said last week or the week before, which was the one of the things that you noticed is the difference between what you've done with PT and the yoga influence programming that you've been doing. Uh, is it Karu? Is that the yeah, Kari. And so really what I'd love to get you talking a little bit about, you made the comment that the kind of the diagnostic assessment aspect was the thing that you see as being different there.
Mm-hmm.
So can you like talk about how that diagnostic and assessment piece has felt unique working with us versus other things that you've done? And I think you had also shared that like specific detail about like noticing what it felt like to lay on your back. And I'd love to have you unpack that.
Yeah, yeah. And so you're just to clarify, talking about like the diagnostics that I've done with you specifically. Yes, yeah, okay, yeah. No, I was actually just thinking about that because there's been a couple of times, one coming out of injury, but I even remember more informally, like you were talking about, the this was a little one, but it was really big for me. Was doing overhead presses. I've always had really tight shoulders, and I would feel this tension right at the top of the shoulder, and it would feel like, okay, I feel like I've got more in the tank, but it feels like if I push it, I might tear something here. It was just one Saturday. I think it was just you and I in the gym, and I was like, "What's going on here?" And you basically took 15, 20 minutes to draw out the diagram of the shoulder and show me how it's supposed to be moving and how mine was moving and how I could correct that. And saw huge improvements there. The ability to push weights, and the ability to move my shoulder in a more functional way changed immediately. And then also last year, I remember just having a recurring back issue that I'd seen PTs on. I tried to focus on this a bit in the CARE program and had seen some improvement there, but it kept on popping up. So you took it upon yourself to say like, "Ooh, I don't like how your back keeps on getting tweaked. Let's just take 20 minutes to do a diagnostic." You had me get into different positions, see how different things were moving, and identified really what the problem was: internal rotation of my right hip. And so gave me a handful of things to work on that and just working on those a few times a week, little band exercises and stretches and things like that. I saw huge improvements very quickly. So that was great. And then the more formal one that we had coming out of the leg break, I feel like you did a really good job of being careful with the injury and seeing, okay, what all is going on here, what asymmetries, what dysfunctional movement patterns are happening as a result of this injury, and how can we go by, moving through those piece by piece over the next few months to try to get me back ready for ski season and ready to get just back in my normal activities.
Yeah. And that's
Yeah.
been and like that one since the knee surgery has been it's been really cool to see too. Like there's a piece of that that we haven't talked about yet
Hmm.
is just the amount of time that not even the amount of time, but the connection points between you and Sarah, your PT, and I know Sarah and she and I also communicate. She's communicated with me a lot of times after she's seen you of things that she felt were helpful, note
Hmm.
things she noted. She's actually made some specific exercise selections that we've embedded into
Okay.
our program. And it's always really cool to get to have that triangular relationship of like
Yeah.
with you and with Sarah. Um, because then it's like we basically have the best of all of these different worlds going into like, hey, what is the thing? What are the things that Jonathan needs? And it's also really gratifying to know that there's places where like where different eyes see different things differently
Hmm.
and that the
Yeah.
view from the strength standpoint is unique and valuable on top of what we get from the PT standpoint. I think that's a data point. I think that's a notion that a lot of people miss
Hmm.
is that like it isn't just do the PT then do the strength stuff. It's that like there's threads of PT that come up that like should trickle up to the next level and there's threads of the strength stuff that should trickle down and like maybe inform the PT stuff.
Yeah, I really enjoyed having this collaborative approach with Sarah and you, and being able to have the two of you talk and inform each other, because there's things I remember and things that she remembers, and it's great to have that direct connection between the two of you so that she can hear of my progress in the gym and what I'm progressing well with and what is still sticky, and then you can also hear from her of, okay, what is she noticing as she's doing dry needling, or she's testing this or that, and hearing things that keep on popping up for me that I maybe have not gotten to fully communicate to you. So having all that work together, I feel like has been a supercharge on my recovery.
That's awesome. It's
Yeah.
on my it's on my it kind of remains on my list to find a handful of PTs to take out to coffee just
Yeah.
to have conversations and say, "Hey, who are the people that I want to have like really really close relationships with?"
Hmm.
And yeah, it's like I feel like I should do that with Sarah.
Yeah.
All right, so kind of next topic, next thread. You know, I don't know actually there's inherently another question here too, but one of the things that I'm always thinking about, even if I'm not communicating it, but it's inherent in what we do with programming, whether this is, individualized programming for you or our like Ridgeline or Powder Strong baseline programs, is that we're always trying to balance short-term performance with long-term physical autonomy and confidence, right? The
Hmm.
knowledge that not only you're going to be able to do some long days, but that it's going to be a good season and you've got decades of time in the mountains to continue to play.
Hmm.
I'm curious, like, has your perspective on like longevity and training for longevity trained through the process? And what does it mean for you to be thinking about like, the long term?
Yeah. Yeah. I think that's a great question. Because I think whenever I started out training, it was very specific to the issue I was experiencing of chronic knee pain in the right knee, and just want to get past that and be able to have fun with my friends skiing. And so now, as I've thought more about longevity, we've had some really great conversations about that in the gym of the importance of getting your body in good shape by a certain age. And this could be different for different people, but if you get locked into really bad habits, then eventually that's going to create a lot more injuries and you're just going to be a lot more limited in your activities. And so it's always something I've given a lot more thought to. And it's something that I felt really good about in the last season working in the gym. It's like, okay, I feel like I keep on progressing each time and I feel like I'm getting my body in really good shape. And then even after I broke my leg and came back into it, I could notice, okay, the work I've been putting in over the last few years is really paying off. My ability to bounce back and recover from this, it's so much quicker than whenever I started. And it had a much more sedentary lifestyle for several years. That ability to just stay, or the staying consistent with training has really allowed for that ability to bounce back from this injury that I think a lot of people would, who maybe hadn't have done as much training in the past, would really struggle a lot more with. I certainly struggled a lot more with it whenever I first came back from not even a fresh injury, just years of stagnation related to an older injury. So that has given me a really good perspective on longevity for me of, okay, this is just something that in order for me to be able to continue enjoying activities, enjoying how I feel in my body, that if I can stay consistent with it and I can do so in a sustainable way, if I can, work on this 2 to 3 times a week in the gym and also focus on my recovery, on taking care of my body otherwise, then I feel great in my body and it feels like I can continue progressing in my activities as far as I want. So that has really been how it's changed my perspective.
And one of the things that I think there's a thing that happens for a lot of people coming off of knee surgery is that
Mhm.
they hear a message of like you are limited in your choices and I think a lot of time I think sometimes people take that to be like I'm limited globally
Mhm.
it almost gives them a free pass for not doing a whole lot. And one of the
Yeah.
things that was really nice when you and I started doing individualized programming 3 months ago now was holy
Mhm.
shit. That's been a quarter of a year. That's insane.
Yeah.
I suspect the time has flown more for me than for you in that window. But that you like when we started that, we were loading the hips, we were loading the knee, but we were doing it really gradually and gently. And we deliberately put in a whole bunch of upper body stuff, right? And I think that it's really easy for people to get into the mindset of the only thing I need to do right now is rehab or rebuild this thing, right? If it's a knee or a shoulder, and everything else isn't going to happen. And you said, when you and I first got together and we're talking about that program, you said, I want there to be a whole bunch of upper body stuff in here too. Like I want all of it. And we
Mhm.
just basically over time, we scaled up the leg stuff and pulled back a little bit on the upper body to make room for the other volume to a
Yeah.
place where like you kind of kept what you had and grew some other stuff.
Yeah, it was something that I'd wanted just of, I was really enjoying. I remember making the comment to you during last Powder Strong when we were doing the one armed bent over rows that I was getting to the end to like the largest kettlebell that you
Yeah.
had and giving you a little shit of like you need to get some more kettlebells for me.
Right.
So I
Yep.
had really enjoyed the progress that I made in my upper body strength and definitely didn't want to lose that. But then also talking with Sarah, the PT, she had recommended that as well of, hey, you need to get back in the gym. You need to things that I hate that I asked for.
Yeah. Yeah. Yeah.
Yeah.
And you know what? And that's also a thing that I truly love about I love that Sarah is doing that too. Because again, I
Hmm.
think like the PT mindset is very often, and we've talked about other physical therapists,
Yeah.
and I think that like the other physical therapists you and I talked about, I actually suspect that their statement have been like, "Hey, the knee's the thing. Focus on the knee. Just worry about the knee. I only want to
Right.
talk about the knee." And I really love that Sarah was able to support you with
Hmm.
that. And then also that you like, I don't know if she said it to me that you should be doing upper body stuff or if that was just that you had communicated. But I think that is a really important part. And for you having that as an outlet, like when you
Hmm.
couldn't push the legs as hard, but you could still push the upper body hard. It's like I
Yeah.
think that's probably mentally more important than we might usually think.
Yeah. Yeah. I've been so used to utilizing the gym as a stress relief and a regulatory thing
Yeah.
for my whole nervous system. And when there's a stressful day, I found so much value in just going to the gym and working through those emotions in the gym. I really appreciate that the gym has a space for that. There's definitely been times when I've been angry or sad or things like that, and I never feel any certain way about expressing those emotions in the gym and even talking about them at times. It's a really great place for that. And so I knew coming out of the surgery that having to be stagnant was going to be difficult, and that as soon as I could get back into it, that was going to be something really great for my mental health. And yeah, I think both Sarah supporting that, you supporting that, and giving me the space for going hard on the upper body when the lower body wasn't ready to take much load was really helpful.
Yeah, I love that. So finally, if someone else there is facing a similar journey, right? Maybe dealing with some injuries or just getting started with a program like Powder Strong or just working with in general, encouragement or tips, what would you give them based on your experience?
Yeah, I would say find people who are really passionate about movements and about how to create more functional movement patterns and how to build strength to support that. I've really found that in you. I found that in the Kari program. Sarah is great at that. Chelsea over at the front, who used to work with you, also great. I've found so much value in finding people who are really passionate about this. And for my specific needs, you have been a great fit for someone who is really passionate, really caring, able to look at different issues that tend to come up over and over and come up with a good diagnostic and a really good plan to help solve for whatever that issue is. I mean, there's probably at least half a dozen things now that you've helped me work through in a way that I would not expect a typical coach or gym owner to really take the time to sit down and do that, particularly not for, most of my experience with you has been in group classes. I wouldn't expect that from most people. But yeah, find someone who's willing to take the time to help you on that journey and be curious, ask questions. When something pops up that you're feeling, lean into what that sensation is. If it keeps on popping up, voice that, be curious about it, try to figure out what is causing those dysfunctional movement patterns or putting too much strain in an area. And it's something that it would take me a while to figure out, but it became a lot quicker to figure those things out as I found people who were passionate about movement and about just what is the quote that you have on the board, move by design, not by default.
Oh, yeah. Yeah.
Who have that passion of creating more design in your movements and not just staying in the default patterns that are continuously creating that discomfort or that limitation with what you're doing. There's ways to get around it. And yeah, I think finding passionate people and being curious goes a really long way to getting you back to being able to just enjoy your activities without pain and discomfort.
And I think there's always working with people always has for me multiple sources of joy. And
Mm-hmm.
like one of those is like I genuinely enjoy spending time with you. You and I
Yeah.
always have really interesting conversations, even if we're not talking about movement. But the
Mm-hmm.
second layer of that is how much you pay attention to how you're feeling, what's happening in your body. And through dialogue, it's like any coach who has spent time in this field and has sought out other education, right? And like does continuing education work. There's any number of theories and philosophies and methods and sets of principles that we can kind of tie to. But what's really and then we try to put those principles into action and the theories into action. But it's when I take those principles and those theories and I get to apply them not to Jonathan, but with
Mm-hmm.
Jonathan and get
Yeah.
Jonathan's feedback on it. It makes my it builds my skill set, right? It's the here are the applications of this. And it'll be a little bit different for everybody, but it's just I'm saying that really to highlight the incredible amount of value that I
Mm-hmm.
also get out of all of our conversations and all of our work together. Cause it's
Yeah.
yeah, okay, here's what's working, or here's an idea. Let's test this. Yeah, thumbs up, thumbs down. That always makes me a lot better at my job too. So, like,
Yeah.
I so dearly appreciate like your trust and your patience over the last 3 years, and especially getting me able to go deep with you for the last 3 months. Like this has
Mm-hmm.
been really awesome.
Yeah, no, that's something that I really respected about how your mind works because there's sometimes where I'm like, I'm just noticing this or I'm curious about this. And you might have an opinion, but I'll see how your brain is like layering in the details of maybe you have more of a vague idea about this, but it's filling in and sometimes you catch yourself and you're like, well, this is what I think about it, but I'm not sure. Let's test this out. We've got a hypothesis here and we can explore this further. And so that like continual approach of just trying to figure things out, it's something that I've always really looked forward for in particularly healthcare workers, but anyone is, are they good general generalized problem solver? Are they going to look at a topic and not just lay in their bias and lay in, what they were taught, but be really curious about what's going on and trying to figure it out for that individual, since everybody is different and everyone's experiences is different, and what they might be feeling might be different than how someone else would experience that. There's just a great curiosity that, yeah, whenever we have those conversations, I learn a lot, and I can tell it helps to sharpen your thinking as well, which I really appreciate.
Yeah. I think one of my favorites was sometimes my favorite is always the hypothetical, the thing that doesn't
Mm-hmm.
have anything to do with you, because
Yeah.
then it's just a thought experiment, right? There's no, and it was like the woman who was on Twitter, X, wherever,
Yes.
like
Yeah.
training for weightlifting, and you were noticing like there was all these online comments about what she was doing and that she was going to kill herself. And you had this you just started with this question of Kelly Starrett says feet should be here.
Right.
Her feet are here.
Yeah.
Like discuss.
Right.
And it's like those kinds of things are where we just get to play with ideas. And I think
Mm-hmm.
like to know that you enjoy being a player with ideas as well is just super.
Yeah.
It's really makes it.
Yeah. No, that was a fun conversation because I learned a lot. I think I realized how stuck my mind was in this like very, um, yeah, very rigid way of thinking of like, okay, everything needs to be stacked this way, and the knee should never cave in at any point. That's dangerous, and we're able to get a better understanding of, well, kind of depends. It depends on what you're going for and what your goals are and what your priorities are, and sometimes, especially in a very competitive setting, you might be willing to take a little bit of a hit for longevity, and that's a personal decision. But yeah, it was a really interesting conversation. I really enjoyed that one.
Love those. Well, Jonathan, that was all my stuff.
Mhm.
Thank you. Thank you for again for your trust and your confidence over the years, and thank you for this conversation.
Yeah, I really appreciate it. I've really enjoyed your passion when it comes to this, and I remember you were on some tangents one time.
No way.
Mar-
Say it ain't so.
right, right. This never happens.
Yeah.
With Margaret and I forget who else was there in the gym, and you were like, "Oh, I'm sorry, I'm on this tangent now," and she was like, "This is what we pay you for. We pay you for this passion." So it really comes through in so many of our interactions, and yeah, it's definitely what's kept me coming back and kept my trust in you for helping, especially with coming out of this leg break.